thanks, Tommy, which I got when right before I had Bradley, but after Bennett. And I had a little extra flub on my stomach, and I, went and got that taken out. But I wasn't like, I want my this done, I want that. It wasn't, and if I wouldn't have gotten either one, I would have been fine too. It wasn't, it was like, oh, we need some people to get lipo on the arms. Anybody want it? I was like, well, shoot. I looked, I'm like, okay, I'll get some lipo on my arm. It's kind of like that. It wasn't like a big deal. It wasn't like, but people will, when they have these long lists, they'll be so, oh, my elbows were fine, thanks. When they have these long lists, they'll be so like serious about, I got to get it all done. I have to get, and even when I try to like reason with them and say, well, it's not really safe for you to get liposuction in all those areas at one time. We need to break that up, or, they're not, a lot of times they don't want to hear it at all. And so when you get to that place of desperation, then that also, even if you can afford it, even if money isn't the issue, but then I'm saying, it might take 2 surgeries or something like that. People will be like, no, I need to get it all done now, and not really be concerned about the risks that I'm telling them are there. Like, they literally just kind of like ignore it. They ignore me, and they're focused on getting all this stuff done, and, it just kind of bothers me when people want to change so many things about themselves. Like, it's just, you're beautiful. And I always tell my patients that just because I can change it doesn't mean something's wrong with you. Notice these, something factor for me is that I'm very self-critical. So I notice these small differences post-op, and then I really, hold on, it just moved. Okay. And then I really dwell on those differences. For example, the smallest dog ears, slight difference between flanks, etc. Susan, that's a great point. Okay. So you're different on both sides before the surgery happens. Every human on this planet is asymmetric. And for this reason, I always point out, I do my best to try to point out the differences that I see from side to side before surgery. And the reason why, because most people don't even notice the differences that they have between the two halves of their body until after their body is modified. And then your eyes zero in on it. And trying to make it perfect when God couldn't make you perfectly. God didn't make us perfectly symmetric, so you can't expect a human to do it. And so focusing on these little things is not good for you. So you can keep going in for surgery to try to correct these little things. And every time an area is resurgerized, you have complications. You have a higher risk of complications each time you do surgery on an area that has already had surgery on it. Your blood supply is less, you have less blood supply each time it's cut into. Like, some blood vessels are cut off, and then some of them reform, some of them don't. So you have more scar tissue in the area. The more scar, every time you operate on the same area again, it's going to create more scar tissue than what you had the last time. And so each time, and so when you have scar tissue, less blood supply, that sets you up for infection. And not saying that you're going to get an infection just because you get a resurgery. No. What I'm saying is you just have a higher risk of complication when you go back to the same area, multiple times. And sitting there and staring at yourself and looking for something wrong, you will find something. It's just like, that's in life in general, not even just with plastic surgery. If you start looking for something to be wrong, you will find it. You're going to find what it is that you're looking for. So if you sit and stare at yourself to look for things wrong, that is just tearing yourself apart. If people took that kind of energy to focus on the things that are wrong with their personality, their mindset, all of that kind of stuff, their lives would shift in a way where they didn't have to focus on their appearance so much. And I'm not saying don't focus on your appearance, because I like being pretty just like the next woman. Not saying that, but I put way more energy into my mind, my soul, and my heart than I do into my looks. Way more. I almost forget that I'm pretty. I know I'm pretty. I almost forget that. When I was younger, I was more conscious of that. Now if somebody says, tell me about yourself, nothing physical would come to my mind to describe myself. I would be thinking about Myla, the person. But when you're sitting and staring at everything physical on you, you're setting yourself up for trouble. So yes, there are going to be discrepancies post-op because there were discrepancies pre-op in every human. And if you have a little dog ear, that, yes, that could be corrected. That doesn't have to stay. That's not a big deal. That's not a big deal. But slight differences in one flank to the other, you probably had that beforehand, and now it's more noticeable to you because your body changed. It's like when I tell people when they get a breast augmentation, I'll go and and most people that get a breast aug, they get the same size implant on both sides. If I don't tell them, okay, this breast is slightly higher than that breast, this breast is a little bit bigger than that one, your nipple is slightly lower on this breast and that breast, and then I go and put the exact same implants, the exact same size implants in their breast, they will be like, this one's higher, this one's this, if I don't point it out first, and then they'll think I'm backtracking when I try to tell them it was like that in the first place. When you get a breast augmentation, the implant simply magnifies the breast that you already have, unless some other stuff is done with your breast augmentation. But a standard breast augmentation where we just take implants and put it in there and make your breast bigger, it's going to make the breast you have bigger. So if one is slightly higher, or one nipple is slightly higher, or one is slightly bigger, it was like that before. Everybody's bodies are asymmetrical. People will come in and be like, see, I got this one, like my one brow is like right there, and this was like I'm like, most everybody's brows are not exactly the same. It's normal. That's normal. In fact, if you take your face like digitally, and let's cut it in half and just transpose it to the other side, you'll look strange. Perfect symmetry on a human face is not pretty. Try it. I'm sure there's some app where you can cut your face in half and transpose the other side over, and it's going to look weird because you're not symmetric. So don't go and try to find something that's different after you get a surgery. Like, that's not, you should go into it with a positive mind and come out of it with a positive mind, and don't sit and stare at yourself and look for something to be wrong, because that is how you end up on the road to addiction, where you're getting procedure after procedure after procedure. Like, it always hurts my heart when I see ladies saying, oh, on my way for round 3. Huh? Like, either you were way too big, which is probably not the case, but maybe it was, or you're doing exactly what you just mentioned. Somebody's doing exactly what you just mentioned, which is they come back and they're staring at stuff. The other thing that people are doing is because this happens a lot, right after their surgery, they'll be happy, like for a few months, posting all these pictures in their new outfits and all of this other stuff, and the body selfies to show how cute, how cute their new frame is or whatever. And then all of a sudden that high kind of wears off from the initial operation they got, and they'll start to feel like they want something else. Because I don't care how great your result is, if you are living on Instagram, living in these plastic surgery groups, and looking at before and after pictures constantly, somebody's gonna scroll through your timeline who you think looks better than you, and then that's gonna make you want more. Not good. That's not good. What you feed your brain is what you're gonna put out, and so you don't want to get yourself all consumed with plastic surgery and your appearance. And I think that happens to a lot of ladies. They will get into that once they get into the world, or they start exploring the world and, waiting on their surgery turn, and they get their surgery, then they're posting their pictures to the groups that they were in, and then they're seeing other people's pictures, and then they're like, well, dang, her stomach's flatter than mine, or her waist is smaller than mine, or her boobs are bigger than mine, or her lift is better than mine, or her nose is, and you go and compare yourself to other people that you see, and you'll never be happy. So then you're like, well, I'm gonna go get my so-and-so done again, trying to reach, and then that's how it just keeps going. So it's just a vicious, toxic cycle. Have you watched She's Gotta Have It on Netflix? Spike Lee made it a point to address this on his show. I didn't watch it. I saw where somebody had took their phone and like recorded it from their TV screen and posted the clip of the girl in the strip club and fell over and her butt exploded. And I was irritated when I saw that, so I didn't want to watch it. But my girlfriend was telling me today that he was trying to make a point with that. But I did see the clip where the girl went into that hotel room, and the girl was cute, and I thought her body was cute. And, she lay there and let them people torture her doing those butt shots in that hotel room, which is another another thing, what I was talking about, like the desperation thing, because people will get in their minds that everything will be better if they have this or that, and put themselves in really bad situations. Like, so the girl was basically being tortured to get that stuff in there, and she did it willingly because she thought it was gonna like change her life for the better just to have a bigger butt. Like, it's insane. Okay, let me see. Can you get a mommy makeover and a brachioplasty together safely? The mommy makeover, the number of surgeries you can get depends on the number of the amount of the speed of the surgeon, if they have people helping them close and sew and stuff like that. So, or if it's more than one surgeon working on you at the same time, which happens too sometimes. So, yes, you can get it safely, but in the right environment. Hair on fleek, eyebrows. Oh, thanks, Tommy. Lipo on the chin. When I do lipo on the chin, you're gonna be, as with any lipo, you're gonna kind of be healing for several months. However, I have people wearing a garment around their neck 24/7 for 7 days, and then they wear it when they get home every day for, like a month or so after that. I'm just scrolling down looking for questions. What about reduction? What's the question about reduction, Erica? If you're still on, I have a better side. That is why I'm part of hair to accent the side I like best. Right. Everybody has a good side, and we all have a good side because we're not symmetric, and that's normal, and that's okay. Like, trying to strive for perfection, physical perfection, is dangerous. And I think that that people spend so much energy on their appearance, they should channel some of that energy on the inside of them and their growth as a human and maturity and, finding their purpose and, trying to be a better person each day than they were the day before. Like, that part of yourself too is very important. And that stuff also makes you beautiful. Like, it's just like when you meet a person and they're really pretty to you, or a guy is really handsome, and then you get to know them and you almost don't even see that anymore because the person is not a good one. Or you meet someone and you don't even really pay attention to their appearance. You don't think much of them, or maybe you might even think they're not attractive. And then if they have a great soul and a beautiful heart, then all of a sudden